Hi, hello everyone. Welcome back to Nursing Guru. In today's video, I am going to discuss about hospital acquired infection. Hospital acquired infection is also known as nosocomial infections. Coming to the definitions, what is the definition of hospital acquired infection or nosocomial infection? The nosocomial infection or hospital acquired infection can be defined as the infection developed in the patients after admission or discharge from the hospital within 48 hours. Within 48 hours, any infection developed in the patient, we used to consider as a hospital acquired infections. Okay, coming to the mode of transmission, how the disease is going to spread. The disease is going to spread from one person to another person. It may be direct contact or it may be indirect contact. In direct contact, it may be spread through hugging, kissing, shaking of hands, sexual contact. Okay, and coming to the indirect contact. In the indirect contact, the mode of transmission of the disease is through cloths, or it may be like insects, mosquito for example malaria, dengue, right? Then the inanimate objects like pen, pencil. If any person is infected, if using any cloth, pen, pencil, then if the another person also using the same things, then the diseases will spread from that person to this person. Okay, this is about mode of transmission. In mode of transmissions, how many types? There are direct and indirect contact. Coming to the types of hospital acquired infection. In types, the first one is urinary tract infection, and the second one is surgical site wound infection, and the next one the ventilator associated infection, and the last one is central line bloodstream associated infections. By one we can discuss what is the urinary tract infection and what is surgical site infection. Surgical site wound infection, it can be defined as infection that occurs after the surgery, in the place where the surgery takes place. When after the surgery, if any infection developed in that place, we used to consider as a surgical site wound infections. Coming to the preventive, prevention is better than cure, right? So we have to prevent the surgical site wound infection. So the first thing is gloves. Gloves can reduce the transmission of pathogens. You all know what is pathogen. Pathogens is like virus, bacteria and fungus. All microorganisms can cause the infection. So by using the gloves, we can reduce the transmission of pathogens. And the next one is use the petroleum based hand lotions. While we are scrubbing our hands, with the hand lotion should be in the petroleum based hand lotion should be used. Then the skin preparations before surgery, it will remove the harmful bacteria. If once the patient is sending for the operation OT, the skin preparation should be done, because we can remove the most of the bacteria by doing skin preparation. And the next one is the doctors should use gowns and head coverings. The next one is the sterile dressing. While the nurse is doing dressing for the patient or changing the dressing, the sterile technique should be maintained. And sterilization of critical equipments. After the use of equipments in the OT, it should be sterilized properly. And the disinfectant of non-critical equipments also is needed. And the next one is proper incision care. After the wound is getting recovered, we are changing the dressing. So the proper incision care should be done. And the sterile dressing, proper wound care, everything is needed to prevent the surgical site wound infection. This is about surgical site wound infection. And coming to the next topic, UTI. This is the very much important topic of your syllabus, urinary tract infection. Urinary tract infection means the infection of any part of the urinary systems. It associated with pain and burning sensation while urinations. While the patient is passing urine, the patient may feel pain and burning sensation in the urinary systems. Prevention of urinary tract infections. How we are going to prevent urinary tract infections? The infection can prevented by strict asepsis techniques during catheterization. Even taking precautions during catheterization also may leads to the transmission of infection, and it can cause the urinary tract infections. And the next one, drink plenty of fluid and waters, because when the patient is drinking more water, it will flush the urinary system. By flushing the urinary system, we can remove most of the bacteria from the urinary system. And the cranberry juice should be promoted for the patients. It can prevent and it can treat the urinary tract infections. And we have to treat the vaginal infection such as thrush. Okay, if any vagina infection means, we have to provide the treatment first. If you are providing treatment for vaginal infection, that also can prevent the urinary tract infections. The next topic is ventilator associated events. The ventilator associated infection is caused in the patients who are taking ventilations. The ventilation patients will develop these infections. The next topic is the preventive measures of ventilator associated infection. How we can prevent that? The first one is, we have to avoid the intubation, and the second one, minimize sedation. We have to minimize the usage of sedation and minimize the mechanical ventilation exposures. We have to reduce the mechanical ventilation exposure. And the next one, low tidal volume ventilations. Proper oral hygiene care. We have to follow the oral hygiene care to prevent the ventilator associated infection, and we have to change the position, maintain the optimal positioning of the patient. It can also reduce the ventilator associated infection. Let's move to the next topic, that is central line associated bloodstream infection. The definition of central line associated bloodstream infection, it can be defined as serious infection that develops when microbes enters into the bloodstream through central line. When we are inserting catheters, there is a chance of entry of microorganisms into our blood. Then these microorganisms will develop in the blood and it will lead to the infections. This is the definition of central line associated infections. Preventive measures. Use appropriate hand hygienes. The hand hygiene is most important to prevent these infections. The nurse is the key to spread infection from one person to another person. So before inserting catheter and after inserting catheter, she have to follow the hand hygienes. The next one is use of chlorhexidine for skin preparation. While we sending the patient for surgery, we have to do the skin preparation with using of chlorhexidine solutions. Avoid using of femoral vein for insertion of catheters, and use of full barrier precaution while inserting the catheter. We have to follow the barrier precautions when we are inserting the catheterization, and remove all unnecessary catheters. If there is no use of the catheter, we have to remove immediately. These are the preventive measures of central line associated bloodstream infections. And the next topic is surveillance of HAI. HAI means the hospital acquired infections. The surveillance of hospital acquired infection is defined as important to identify the high-risk population and programs and efforts to reduce the incidence of HAI. We have to focus on reducing hospital acquired infections. So we are going to use the surveillance of HAI. In surveillance of HAI, there are infection control team and infection control committee. The infection control team consists of the officers, infection control officer, and the second one a microbiologist, and the third one a infection control nurse. The infection control team is very much important to identify and to prevent the spread of infection in the hospital. This infection control teams are responsible in the hospital to identify and to prevent the spread of infection from one person to another persons. This is about infection control team. The next topic is Infection Control Committee. The Infection Control Committee is a multidisciplinary committee which is responsible for monitoring programs, policies, information, implementation and corrective actions. Coming to the objectives. What are the objectives of Infection Control Committee? To understand the basic infection control concept, and the next one to identify the cause of nosocomial infection and to identify the components of infection. These are the objectives. And control programs. How we can control the spread of infection from one person to another person. Control program. The infection control community can decrease the incidence of microbial resistance. So, the infection control committee is responsible to reduce or to decrease the spread of infection in the hospitals. This committee and the control teams is going to take care of the patients in the hospitals by the infections. Okay, in today's video we are discuss regarding what is hospital acquired infection or nosocomial infection, and the next we discuss regarding mode of transmission and the types. In types we discuss regarding the urinary tract infection and surgical site wound infection and the central line associated bloodstream infection, and the last one ventilator associated events, and the last topic we discussed is surveillance of HAI. This is the important topics in the HAI. If you have any doubt in this topic, please comment below. Please like and subscribe our Nursing Guru YouTube channel. Thank you.